Hey everyone, and welcome back to Meet the Penis 110. And today we're talking about something that every implant patient has struggled with at some point. Deflating your penile implant. That's right, the great deflate. Now you'd be surprised how many creative ways guys have tried to get their implant down. I had one guy using barbecue tongs, another tried a sock filled with rice, and me, I've got this trusty lobster claw toy my kid left in the office and seems to work pretty well. But we're not pinching crab legs here, fellas. Let's be real. Most post-op calls we get are not about getting it up, they're about getting it back down. It's not performance anxiety, it's where the heck is the deflate button? And here's the good news. It's not broken, it's not you. It's usually just a matter of technique. And today I'm going to show you how to master it. Now know your pump. There are three major penile implant companies. Coloplast, which we use a lot here at Peter Urology, has a two-sided deflate button, and you gotta press both sides firmly at the same time, like squeezing a grape through a paper bag. Boston Scientific, this one has a one-touch deflate valve. Just press and hold for 4 to 6 seconds and let it do its thing. And we have the new Rigicon, which has the same idea where you just press, hold, and you massage the shaft downward to push the fluid back. And the best part, each company gives you a little practice keychain pump to play with. This isn't a party favor, it's a personal coach. Use it to get to know your pump before and after surgery. Having these are very important during your penile rehab. And there is a trick that a patient taught me last year, a good friend of ours, a pilot, and it's helped so many others. And the trick is, use a thin washcloth or paper towel to grip the pump. Use it like a set of gloves because the extra texture gives you traction, especially when you're swollen and sore in these areas. And another tip, once they allow you, take a hot shower or apply a warm towel to your scrotum for 5 or 10 minutes before trying to deflate. Warm tissue is soft tissue, and soft tissue moves better. And here's how I like to explain it. Finding your pump essentially is looking for a grape inside of a water balloon. So what did I do? I put this pump inside of a water balloon. It was definitely not as easy as I thought, but the idea is the same. The pump's inside, we're reaching above, and we're looking for that deflate button. It is there. Reach high into that scrotum and don't just poke around at the bottom. Slide your fingers up and down the tubing, and once you find that grape that doesn't hurt when you squeeze it, that's your pump. Hold it steady and press through that balloon like feeling until you have the deflate tabs or the button depending on your implant. Now, hand position and grip technique are imperative to be able to deflate your mechanism effectively. I recommend making the OK hand gesture like this, using your dominant hand, or if you're from Texas, you can give it all hook 'em horns, right? Now that grip gives you natural leverage on either side of the pump, and you can also use both hands. One hand, preferably your dominant hand, to locate and hold the tubing and pump and secure while your other hand grabs the valve. Now the other hand, your non-dominant hand, that's the one that you're gonna use to press your penis and deflate going from front to middle to back. Now here's the key. Once you feel the button is being properly pressed, use your non-dominant hand, again, to feel. If you are squeezing very hard and firm and you're not feeling that release or you're not feeling it soften up, don't panic. Almost always, it's user error. You probably need to reposition your grip slightly, move your fingers around until you feel those buttons, hold your keychain in one hand while you have your scrotum in the other, because you will find those landmarks just like that. It's tactile memory is everything. And of course, some patients are simply too swollen to attempt this maneuver in the first few days or weeks. If that's the case, or if there's any doubt, reach out to your penile implanter. That's what we're here for. Now, I always tell my patients this. You have to walk before you run. You have to soft toss before you can throw the fastball. This is just like rotator cuff rehab, but for your penis. You don't build strength and confidence overnight, but every time you go to the bathroom, that's practice time. I personally believe you should try to deflate every single time you urinate, especially in the early weeks until it becomes second nature. Don't let it sit inflated because it's easier. You're not doing your future self any favors by skipping reps. And don't panic. You're not alone. Please hear this. Don't get discouraged. If you're struggling at first, you will get better. We rarely get those calls saying that, Doc, I just can't get it. It takes an extra second to feel everything, but I promise, if you stick to our instructions, you should have an awesome outcome. It's all part of the process and you'll get there. And just like the rest of our guys who are now living their best lives, you will too. Now, a few things, what not to do. Let's just be clear about what not to do. Don't use pliers. Don't try to twist and yank. Don't skip the warm up, and please don't wait until date night to try this for the first time. Instead, use your keychain pump, use the heat, use grip tools like a towel or a paper towel, and go hide in the scrotum and just follow the tubing down. Most importantly, give yourself grace. Deflation isn't about brute strength, it's about technique, patience, and repetition. You want to be proud of your implant, not wrestling it like it's a lobster every morning. Now, I'm Dr. Alfie, and this has been Meet the Penis, where we kick things up and teach you how to bring them down like a pro. See you next time. Now go practice that deflate and leave your barbecue tongues alone where they belong. Take care.